Today we're creating greater awareness on mental health and mental health access.
We're here really to talk about a survey that we both participated in, survey of 5,000 Americans asking them about can they get help when they need it. So what we found is that 6 out of every 10 Americans has looked for help for a mental illness for themselves or a loved one, and that 76% of all Americans believe that mental health is as important as physical health, which is a tremendous change over the last 5 to 10 years.
We have mental health access to quality care problem in America, and I think that's why we're seeing high levels of suicides and people suffering in silence.
And one of the things we see is that people don't know where to go and they don't know how to pay for it. They don't understand that there is a parity law across this nation. Insurance companies must treat mental illnesses the way they do physical illnesses. We're trying to make sure that every community has help by establishing clinics and by having philanthropists like Stephen Cohen step up to the plate.
Who established the Cohen Veterans Network, which is a network of 25 clinics across America providing free care to veterans and military families. We're reducing barriers to care like access, cost, transportation, daycare. None of this would be possible in the current systems that we have across America if it weren't for Mr. Cohen's philanthropic giving.
And we hope others will step up to that while we're trying to establish certified community behavioral health clinics in every community. The other thing we're looking at is younger people are even more likely than older people to look for help, to want to know where to go. And that's an important issue. We have to really serve the people who are our future.
People are starting to recognize from our study, they told us that people in their family need help and they believe that getting help is just as important as getting physical care. If we had more accessible services, if we use technology like telehealth and mobile apps, and we really began to grow this engagement strategy, I think we would reduce stigma once more people got into care, because we've learned from the study that when people are in care, they like the services they get. To find the Cohen Veterans Network and the study results, you can go to cohenveteransnetwork.org
or thenationalcouncil.org.